Navigating one of the largest local health departments in the country means navigating funding disruptions, measles outbreaks, and a shifting political landscape all at once. Listen to hear how cross-sector partnerships are built by design, why telling the public health story in plain language matters more than ever, and what it looks like to earn national reaccreditation in the middle of the storm. You're listening to the PHEC podcast, episode 457. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and other community-focused organizations as well. We specialize in a variety of community assessments, workshops, and trainings, ultimately helping our clients communicate their health information in plain language to their community partners as well as the broader communities they serve. Now, in addition to different types of data analysis, the support that we provide often falls in the category of strategic planning and sometimes capacity building. It just depends upon the needs of our clients. So please reach out to us at our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. The links also will be provided in the show notes. Now, I'm excited to introduce you to my guest on this episode. My guest is Dr. Claude Jacob. He serves as the Public Health Director of the City of San Antonio Metropolitan Health District, located in Southwest Texas, a jurisdiction of 2.1 million residents. With 30 years of experience across 4 states, he brings a grounded, community-centered perspective to one of public health's largest challenges right now, doing more with less, while the value of the work is being questioned publicly. We talk about building resilient systems and the power of cross-sector collaboration, communicating public health to everyday people, and what the upcoming American Public Health Association's annual meeting means for the field. Now, I'd like to connect my conversation with Dr. Jacob right after we highlight our sponsor for this episode. Public health is about connection, and now you have a space built just for that. The PHEC Podcast Community app is where public health professionals come together to collaborate, share ideas, and support one another. Inside, you'll find exclusive events like Power Hour, which is our virtual co-working event. It helps you connect with others and boost your productivity. You'll also have direct access to conversations with other public health professionals from around the world, and even guests from previous podcast episodes. We're more than a podcast. We're a thriving community. Be a part of it. Download the PHEC Podcast Community app today and join us. Dr. Jacob, welcome to the podcast. How are you?
Hey, not bad. Thank you for having me.
Yeah, we've been putting this interview together for quite a while, and I'm excited for the conversation. There's so many things to get to know you better. We bumped into each other several times over the last few years at conferences, and this being a year that the American Public Health Association's annual meeting is going to be held in your town, thought is like we really needed to make this happen. So let's start with an introduction. Why don't you tell everyone a little bit about yourself?
Well, thank you again for this invitation, Dr. Huntley. Again, important to use honorifics, but I realize that our paths have crossed many times over the last few years. So really pleased and honored to share, at least our perspective, what's about to happen this fall here in sunny San Antonio, here in Southwest Texas. So, Claude Jacob, I would say that I'm an islander, first generation from the Caribbean. My folks came to the States in the 1960s, and it literally shaped my journey. Moved around a bit, but I do consider Chicago to be my hometown. So to be very clear, I'm from the Chi. Grew up on the north side of the city, Cubs fan, Bulls fan, diehard Bears fan. So I want to at least acknowledge that. But my formal professional journey spans 30 years across 4 different states. So between Illinois, Maryland, Massachusetts, where I spent half my career at the Cambridge Public Health Department in the city of Cambridge, Massachusetts, and then here in Texas, now going on 5 years. So all that to say that I want to at least share my perspective, but also appreciating this opportunity to share my story.
Yeah, yeah, that's incredible journey and just some of the places you've touched on. I bet we know people in those overlapping cities and areas. I have a family from Chicago, so I understand there's a certain element with the cultural people that are coming out of Chicago that I know from my family. So I hear it in your voice.
We are proud. And again, just for those basketball aficionados, so I know this past weekend, the Final Four included my alma mater, the University of Illinois at Urbana-Champaign. The Fighting Illini sadly didn't make it to the final, but I'll take it. First time in 21 years getting to the Final Four. So we'll take what we can
Oh,
get.
yeah.
So proud alum of U of I.
Yeah, I definitely relate. Well, so put into context, because by the time this episode comes out, we're not exactly sure yet, but it will be a couple months past the time of the recording. So we're recording this right at the beginning of April, and every conversation has basketball somewhere in that conversation that I'm hearing. So we're going to dive into a whole lot about what you're doing now, which is incredible work. But I always like to start the conversation rolling back to learn a little bit about your journey through public health into where you are now. So my first question is one of my favorite questions to ask my guests, and is, do you remember when you first learned about public health or first really thought about public health as a career?
Great question. And I mentioned at the beginning in terms of my island roots. So grew up in a household of clinicians. Again, I would say health generally, but I can tell you that there was tremendous pressure for me to choose a clinical career with both of my parents being retired clinicians. But you fast forward. So at some point you study what you're interested in. And I remember taking an undergraduate course in community health, and that always caught my eye. And I had considered a career in clinical medicine, but I also pursued a degree in public health. So master's trained, doctorally trained. So I haven't looked back over the last 3 decades. So I had been interested early on, but I will share that what made the most lasting impression was that my folks, every summer when we were on the north side of the city of Chicago, they would bring us to these health fairs, these community health fairs. Again, they hail from Haiti. So there was a large Haitian community on the north side. And I remember that experience watching them navigate that these health fairs had a family friendly feel, and that always appealed to me. Just being there. If nothing else, just running around playing tag with other kids, but really appreciating being in that experience. So it always had an impression. And when you fast forward to my interests, I ended up writing my master's thesis based on that experience. I ended up completing some community service hours on the north side at a nonprofit at the time, just to get my feet wet in terms of what happens in neighborhoods. But really, I've built my career around that experience, and I've had the honor to be in different cities between Chicago, Baltimore, the Boston metro area, and now here in San Antonio in Southwest Texas.
Oh, it's really nice. Those influences, I know that for myself and a lot of the people that I interviewed on the podcast, it's interesting to hear how they discovered public health. And for me, it was similar to yours. Like, I didn't know, I have a lot of clinical folks in my family, that background, and I was going in that direction. I didn't know that public health was a thing, that there was, I could make a career out of it. But once I discovered it, I realized, oh, that's really what I wanted all along. Just didn't know what to call it.
You're spot on. Again, the contrast of different experiences, the third world country where, again, I spent part of my childhood with my folks decided to move back home for a few years before coming back to the States, but also appreciating what we have here in a developed country, just having access to services or having access to clean air, clean water, and just not taking these services for granted. So it is still considered the best kept secret, but I got to tell you, from my experiences over these 30 years, it's been really heartfelt. And I do look back and try to share as much as possible about the work that we do on the ground, especially in these most austere of times, and especially given the impacts of the pandemic from a few years ago.
Yeah. Well, I'd love to follow the trail a little bit. So you've mentioned some major areas that you've lived and worked leading up to your time here in Texas. How has some of those experiences helped shape the work that you're doing now?
It's a great question. Well, again, I've done a number of different activities that supplemented my academic coursework. So besides pursuing formal degrees in public health, I also volunteered in community as well as served on national boards. So I would say that having an asset-based approach has been part and parcel and core to my work. Really, models like the AmeriCorps or neighborhood ambassadors, working with different resources on the ground. While most of my experiences have been tied to government and hospital systems, I do find that having that approach has grounded me, especially over the course of many years. So for me, it's really about making sure that we demonstrate how these partnerships work on the ground. It's about leveraging limited resources. It's about making sure that we pay attention to the plight of what happens in marginalized and underserved communities. I would say, as a discipline, sadly, we are underappreciated, under resourced, under recognized until calamity hits. And so, however it is that we can make the case on the front end so that folks recognize that it's worthwhile investing in governmental public health writ large, that's been part and parcel and core to my career, especially over the course of the last 3 decades.
Yeah. And tell me a bit more about what you do now in San Antonio.
Well, San Antonio, I have the honor of leading the health department in the seventh largest city in the United States. We serve the city of San Antonio and the greater Bexar County. My jurisdiction spans 2.1 million residents. So it's a large enterprise. We've benefited from an investment in our operations over the last few years. Yes, 6 years ago, we experienced the acute disruption felt around the globe with the COVID-19 pandemic. I landed here in July of 2021, so just about halfway through the pandemic. And we've tried to make the case to address the conditions that were exacerbated or worsened because of the pandemic. And I've had the honor and have benefited from getting these investments, whether it's leveraging external grants or making a case to the city's leadership to invest in the work of the department. We've grown substantially, but yet we've plateaued. And now we're seeing and experiencing some of the duress that most health departments are experiencing with the disruption of grants and the pressures around the tax base. So day to day, I oversee large enterprise. We have incredible staff. We have multiple sites strewn across the city, and we don't work in isolation. We work with public safety, with the nonprofit community, with the faith-based organizations, with healthcare institutions, with academic institutions. So it takes a village to do this work, and it's an honor to at least leverage the resources so that we can make greater impacts for the residents who depend on our work.
Yeah, so you just touched on something that I'm gonna have to hang on to for just a little bit because I love this. I believe strongly, and we say this, we meaning typical our public health industry, cross sector collaborations. And I think I say often, we need to lock arms and really come together to be able to serve the communities in the way that the impact that we all envision having, the way that we really want to be able to serve. So that looks like really having conversations with those very different departments, not staying silos. There's no room for silos. So when you mention the fire department, the police department, all of these different agencies really coming together, that's how we need to be like interwoven, right? To be stronger, it can't really separate out, but that's only the way we have to come together in that way to develop a real strong foundation.
Not only that, couldn't agree more, it's got to be by design and not by default.
Yeah.
So, again, if you look at our public health framework, the 10 essential services, if you drill down to the fourth essential service, it talks about strengthening and mobilizing partnerships that work. And so it is required that we work across sectors. So multi-sector, cross-sector collaborations, it's part and parcel to how we got through the lost years of the pandemic. And it's how we're surviving now, even as resources are drying up in certain categories. But it does require that we have enhanced and better partnerships anchored in community. So that's by design. And
Yeah.
we are very intentional in trying to do that work on the ground.
I like that. I often say that community is a strategy, it's strategic, and it has to be. It can't be the afterthought or the thing that when we have funding, we are close, and when we're not, it's a very strategic approach. So this brings me to a really interesting question, actually kind of a nice segue. Now, of course, we're recording this at the beginning of the spring of 2026, and I'm going back to last year, the beginning of 2025, we had the Trump administration. That transition caused a ripple effect of all sorts of things that most of us could not have imagined happening. And it has impacted not just public health, although public health, we feel like we've been intentionally targeted and there's been a big attack on science and misinformation, disinformation is really high, and just so many other industries like that ripple effect all the way through. I'm wondering how you and San Antonio have you been able to navigate some of these shifts, maybe what are some of the biggest challenges and how do you address them? I imagine what you just described, the strategy that's in place has a lot to do with resilience and being able to respond. But I'm just wondering, how has that impacted how you've been able to respond?
It's a great question. Again, we are one of many local health departments on the ground. There are nearly 3,000 local health departments across the United States. So we're not alone in our plight. And again, across local health departments, state health departments, the tribal health departments, we've been feeling the impacts of the rescission of funding, the disruption in the stability of categorical funding. And what it requires on the ground is that we revisit and prioritize where we put our energies, given the limited resources. And it requires us to be even more agile, more nimble as an organization. And we depend even more on our partners to help make sure that those in our jurisdiction are still served. So, yes, we talk about the ripple effects, whether it's the executive orders or whether it's the actual decrease and funding cuts. Over the last few months, we've experienced what I characterize as fire drills, whether it was the disruption to mental health funding. Again, you get an announcement and then you have it reinstated, or the CDC's public health infrastructure grant. Again, there was a scare that lasted about a day and a half. We're one of the direct grantees on the ground. So I can tell you that it has given us some heartburn, especially over the last year, year and a half. But yet it does require us to revisit the design of our programs and initiatives, to revisit where do we have the most impact. And that does take time. It also begs the question for allocating or reallocating resources. So I can tell you it's been keeping us on our toes. The good news is that we're still here. So I do applaud our collective resilience as a department. I do appreciate and thank our partners regularly, only because we're all feeling the pinch. The nonprofit community is feeling the pinch. A number of our partners on the ground, whether they get direct funding or indirect funding, we hear about this. And the more we band together, the better we're able to respond and address and support the residents who depend on our services. So making sure that kids still get vaccinated, making sure that the restaurants still get inspected, making sure that we conduct the case investigations to mitigate the transmission of diseases like measles. Last year, ground zero for the national measles outbreak was just 6 hours west of here. This year, look at what's happening in South Carolina and other states. And so we do require having this capacity on the ground. But to your core question, yes, it's been disruptive. Yes, it's been testing us. It's been a bit of a roller coaster. We were hanging in there and we can better respond to the needs of our residents here in San Antonio and Southwest Texas.
Yeah, thank you for that. I'm here in South Carolina and I attended a conference just a couple of weeks ago, from the time of this recording, but it was our South Carolina Public Health Association conference. And I talked to some folks there specifically about the outbreak in South Carolina, the measles outbreak in South Carolina. It's in the upper part of call it the upstate, but that region of our state. And I'm actually looking forward to bringing on some people on the podcast I invited specifically to come and talk about this. I feel like I'm poking all into the topics now, but these are I don't feel like it's being discussed enough, maybe broadly, without the clutter of all of the misinformation that flies around with it, but really the core of what is actually happening, what's being done, what can we do? Those questions I really want to ask. And so I'm hoping to be able to dive into that a little bit.
No, thank you for however you can share and tell that story. Sadly, we've taken a step back. If you think about our progress over the course of the last couple of decades and our ability to attenuate the transmission of measles, again, very preventable. Last year was tragic that we had those few pediatric deaths that occurred across the nation. And so I would say, however it is that we can make the case, it does require an investment of cash and capacity, but it's also the capability so that we can do a better job messaging and demonstrating to residents across red, blue, purple states why there's value added and making sure that folks and kids in particular are fully vaccinated.
Yeah, absolutely. So, what are some of the challenges that you may be facing currently? Is there anything, maybe not so much challenges, let's switch it around more of maybe how you address those or anything beyond just what I focused on this administration, but how are you all stepping up and really addressing some of the ways that you're serving? How are some programs, initiatives, what's really working, standing out that you'd love to brag about? I'd like to hear that.
No, fantastic question. Clearly, where we are today didn't start overnight. So recognizing some of the patterns, the erosion in funding. So if you go back to 2008 and the economic downturn at that time, most folks lost sight of the fact that over the course of about 8 years, we had about 20 or 25% of our governmental public health workforce sort of contract. And I only mention that because it didn't really become apparent until the pandemic when we realized that we're very fragile. We're already anemic in our infrastructure, and yet we were taking more hits, and it came to crest and it came to light, during the pandemic. So, infrastructure, the lack of investment and capacity, that is still the biggest problem in making sure that we have resources to do the work and protect the populace. But I would tell you that with the legacy of redlining, we do see this disproportionate burden of diseases across zip codes. The patterns don't change. I saw it in Chicago, saw it in Cambridge, saw it in Baltimore, and you see it here in San Antonio. And so understanding what those drivers are and having better policies to address that long history, that sad history, the institutional and structural racism that impacts communities writ large, we do want to make sure that we pay attention to disproportionate burdens. And when we say things like place matters, the fact that your zip code dictates your life expectancy, we need to mitigate that as much as possible. So that's still an ongoing challenge. And it goes back to a long history of divestment from communities. So right now, what's top of mind? It's instability of funding. What's top of mind? It's recognizing that there are competing priorities in terms of where do you put those resources and how do you demonstrate impacts. The fatigue on the ground is real for the staff. Literally, you have fewer hands to do the work and the expectations don't go away. And there's this narrative to your question around the last year or two. There has been this narrative around devaluing public health discipline, moving away from science. And we need to remind folks, we do that at our department, remind the team about anchoring our work to the science and dovetailing that with the art of how we do this work. And so it is both the art and the science. How do we tell our story more effectively? But how do we also ground our decisions in better data to demonstrate impacts? So what we're doing on the ground, I would say, to brag a bit, during the pandemic, we released a San Antonio Forward or SA Forward plan. This was really a 5-year plan to look at the conditions, some conditions that had worsened during the pandemic. So it focuses on these 6 priority areas. Programmatically, it's around food insecurity, mental health, violence prevention, and access to care. But we also realized that we needed to automate and we needed to lean in a bit more. So the other 2 priorities have to do with health equity as well as data and technology infrastructure. So I say that because we had old school paper processes that we needed to migrate to web-based platforms. We needed to staff up, hiring more disease detectives like yourself, trained EPIs in the mix. We needed to staff up in terms of hiring more ambassadors in community health workers. That is a skill set that is invaluable, investing in the power of the trusted source. So in our innovations, we've tried to at least take advantage of some external grants and leverage that with the tax base. So we'll see where we are and what the future may bring, but we are very proud of what we're able to do. And just last fall, we became nationally reaccredited in the midst of all these trials and tribulations. And so I'm really focused on making sure that we take care of the enterprise, Metro Health, the department, but also that we're a better asset, better resource, better partner to community residents out there.
Oh, that's incredible. I like that. And hopefully you are celebrating. Those are some really major accomplishments, especially, like you said, the accreditation, reaccreditation, and during times that we were in, especially last year. So all of that, fantastic. And it really aligns with something that you and I were chatting about before we started the recording. And people who follow this podcast are used to hearing me talk about this. But I think one of the ways that we can, for people who feel like, oh, I don't know what to do right now, one of the things that we can work on, all of us, is communicating our value, really communicating public health in plain language to our friends and family. So if our friends and family really understood public health through our lens, so for myself as an epidemiologist, for my family to understand what that means, what I do, the work that I've done throughout my career in a way that they can explain it to their friends and family, people are starting to get more understanding, greater understanding, and that value gets translated, the value of what we do. Because, we have so many people have said, when public health is at its best, we're silent in the background, which is true. But we need to sell that as, a strength in our service, because people need to know that, they're able to, enjoy that clean water and that clean air and all those things because of that work that we're quietly doing. It's an important election year. So if we're able to get more community buy-in, then, that leads to getting more funding. Also, it hopefully leads to the reduction of being so easily removed and dismantled, but getting more advocates to the table and really getting more funding, like you said, for programs and services that are needed. That is my hope. in that soapbox.
I'm with you. Again, there's a movement afoot. Again, the Campaign for the Public's Health, anchored to the American Public Health Association. There are a number of national partners are part of that effort. Yes, we are living in interesting times. Yes, we're in this endemic state tied to the pandemic itself. Like literally, this is with us now. This is now the norm. But we can apply lessons learned and we can make the case for why it's worthwhile to invest in the work of governmental public health writ large and in concert with partners on the ground. So I say that to say that we have an opportunity. This week, we're celebrating National Public Health Week. Again, this is 30 years of making sure that we elevate the visibility about why support the science of public health. And so I'm proud to be a member of APHA, but I'm also in concert with staff and community partners to tell our story. We've got to do a better job making a case and telling our story about what public health is and what public health does. And for us on the ground, we talk about the 3 Ps, that we are here to prevent the spread of disease or injury, promote healthier lifestyle, and protect the community at large, especially against environmental health risks and hazards. And so however it is that we can get that in the groundwater for folks, I can point to products and community, but we're also trying to do a better job telling our story.
Yeah, I like that. So I'm thinking about time. I'm really enjoying our conversation. I want to be cognizant of time. So I think my last question that I'd like to touch on before we wrap up is coming to San Antonio. I'm pretty excited. I know you got to be excited about hosting the American Public Health Association's annual meeting this year will be in San Antonio the first week of November. So are you excited about that? And what's the significance of that? And
Wow. Yes, very excited. Again, full disclosure, I've been a member of APHA for over 30 years. It is my professional membership association. I've been active in the local affiliates over the years between Illinois, Maryland, Massachusetts, and now here in Texas. We are really excited. It's the first time in over 4 decades that conference is actually coming to the state of Texas. So it is going to be held November 1st through the 4th. The theme this year is Together We Thrive, Health Across the Lifespan. And so it's an opportunity to anchor to the science of our work, to learn a bit, but it's also an opportunity for folks to reconnect and to network. So we typically have a number of students. It's their first time attendance at the national meeting. We're just really thrilled that it's going to be held here in sunny San Antonio in November, again, November 1st to the 4th. And it's an opportunity to elevate the visibility, but also the appreciation and the advocacy for public health.
I'm looking forward to that. And it's been several years. I can't remember the last time I was in San Antonio. I want to say maybe 8 years or so, probably a little bit longer than that. So I'm looking forward to being there again. You shared a video at the end of the last conference. I was in the closing session and you were promoting San Antonio. Come to San Antonio. There was a video and I was like, oh, I was ready for the trip just based off the video. So definitely looking forward to that.
We're looking forward. Again, many have not visited, but I can tell you that, folks like to see the size of the city. They tend to visit the Riverwalk, which is in the heart of the city, historical artifacts like the Missions and the Alamo. So there are different things, different activities for folks. And so wrapping up my 5th year here, I do appreciate the landmass. I mean, this is a much larger city than, say, Boston. But for those that are in for the thrill, we're looking forward to having folks here in November. Just know that this is Southwest Texas, so you're not going to see snow in November. I don't want to jinx us, but just saying that the climate should be palatable, and I want to make sure that you all have fun here while you're here for a few days.
That's awesome. I guess we'll have to get, for the show notes page, we'll have to get a link to the conference link for people that are hearing this. We give them like a free little advertising blurb here. Just genuinely, I mean, it is the association that I've been a very active member for several years and happy to promote and encourage people to attend and excited to be able to visit San Antonio again. So thank you so much for taking time and joining me on this episode. This has been such a great conversation. I think we need to just plan to have you back again in the future because there's so much more that I'd like to chat about, but time won't let us dive into it too much today. Just look forward to having you back again in the future so we can continue our conversation.
Thank you for having me. This was really a pleasure and an honor to share, and looking forward to having you visit with us later this fall for our annual meeting with APHA.
Thank you so much.
You're very welcome.
I really hope you enjoyed that conversation as much as we did. Public health has always done its most important work quietly, but right now, quiet is not enough. Funding is shrinking, misinformation is loud, and the pressure on local health departments is real. What this conversation shows is that staying grounded in the science, leaning on partners, and communicating value in plain language are what keep communities protected when the landscape shifts. You don't have to have all the answers, you just have to stay in the work. I encourage you to connect with Dr. Jacob, learn more about the great work that he's doing in San Antonio. You can find links to connect with him on the show notes page. Now, the show notes page for this episode, which is episode 457, can be found at phecpodcast.com. And once you're there, just navigate to episode 457 to find its show notes. One more thing before we go. Remember that our podcast has an app and private community, which is independent of social media platforms. This is a place where you can engage with public health professionals around the world. Now, in addition to being a part of this amazing community, your membership supports the production of this podcast and episodes like this one. You can download our PHEC podcast community app in your mobile app store, and it is available for both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.